So it's my privilege to introduce the first of our series of spring seminar speakers. Dr. Detmer, who is with us today, completed his undergraduate training at Yale University Medical School at the University of Chicago, and he is board certified in family medicine. Dr. Detmer has worked at Lawndale Christian Health Center in Chicago, Illinois since 1999, and since 2001, he has served as the Chief Clinical Officer of Operations at Lawndale. In this capacity, he works to improve access for patients and to ensure efficient clinical operations. Dr. Detmer is also on the boards of the St. Anthony Hospital in Chicago and the Christian Community Health Fellowship. His topic for today is to change the world of medicine, Lawndale Christian Health Center as a model of faithful presence. And Lawndale and the TMC initiative have a rich and deepening history together that we're excited to share with you about. With us today is Dr. Farr Curlin, who spent years practicing at Lawndale and is one of the co-directors of TMC, and Dr. Calvin Gross, who was a former TMC fellow and also worked in Lawndale in his past. I will let Dr. Detmer introduce his other guests, and we will get started with no further ado. Thank you.
Thanks, Dr. Carlo. It is really exciting for me to be here today. I'm honored to really tell you the story of Lawndale Christian Health Center. It would be difficult for me to overstate the influence that your work through the Center for Theology, Medicine, and Culture, and even before that, the work at University of Chicago with Farr and Dan Macy and John Yoon and others has really been sort of very, very helpful in terms of helping us to think theologically about the work we do. Later, I'm going to introduce Dr. Luisa Olashogo, a psychiatrist who's been at Lawndale for a couple of years with us, as well as Calvin Gross, who was one of, I call him my interns, either a gap year intern who worked for me in 2014, is now finishing his residency training and heading off to Palliative Care Fellowship. They're both also going to share a little bit of their perspective within the context of this idea of faithful presence. This whole framing came about because a few months ago I was contacted by a filmmaker who was working on some training videos for folks to consider what faithful presence looks like in a particular vocation. And I think the way it happened is that as they were interviewing all of the folks down at Duke, Ryan Antiel, who you all know well, suggested that maybe they ought to give us a call up at Lawndale. And so we were able to connect them with some of our providers. And now that whole film series is going to have a connection that hopefully will be smooth. But anyway, we'll come back to that in a bit. And I hope to end fairly early so that we can leave some space for questions. But we were privileged 2 years ago to be funded to start a family medicine training program. And as a part of that, we put together some films to introduce sort of different concepts to the resident applicants. And as I was preparing the slideshow for this, I realized that this film was out there, and that if we play the film right now, it will do a better job introducing Lawndale to you than I'll do just talking to you, because as I speak on the film, you'll get video shots of some of the things happening in the background. So if it's okay with you, I'm going to start this whole series this talk by sharing this 4-minute video that's a bit of an introduction to Lawndale Christian Health Center. So give me a second as I share my screen here.
Now, Lawndale Christian Health Center is a pretty special place. As you may know, it was born out of the vision of some community members and a church that started back in 1978. The health center began in 1984 with the mission of showing and sharing the love of Christ by providing excellent whole person care. And so that mission is what makes this particularly unique. So let me tell you a little bit about the health center. Today we have over 700 employees, probably 140 medical providers. And this year we'll do 175,000 medical visits. We have a fitness center, a cafe, an adult daycare center. Our health center offers comprehensive dentistry service, optometry, integrated behavioral health. Each of those services that we offer is core to the mission of Lawndale. We can't divide, just like we can't divide the body up into parts and treat them as individuals. It all works together as a whole. At Lawndale, we are also privileged to be one of the primary care providers of medical services to people experiencing homelessness in Chicago. As well, we have a comprehensive program that's helping people who are experiencing opioid use disorder through our SUD clinic. These areas of focus for Lawndale are what make this place special. One of the things that we learned early on is that we have to be excellent at traditional medical care, the stuff that you do inside of the exam room. When you come here as a resident, you're going to learn how to take care of people with diabetes and high blood pressure. The fact is that people who live on the west side of Chicago have a life expectancy that's 13 or even 16 years less than folks who live in other parts of our city. In the famous essay, Health is Membership, writer Wendell Berry suggests that community, a place and all its creatures, is the smallest unit of health. And to speak of the health of an isolated individual is a contradiction in terms. We have to be good at the care that we do in the exam rooms, traditional medical care. But 25% of the folks in our neighborhood suffer from post-traumatic stress disorder. Suggesting that they exercise 4 or 5 times a week might not work in our neighborhood. That's why we created a fitness center to allow people a safe place for people to exercise. Currently, thousands of people are accessing that every month. We also have a cafe where people can get a green smoothie or just sit down and do life together. And today, we're filming from the Farm on Ogden, a unique partnership between Lawndale Christian Health Center and the Chicago Botanic Garden. We have lots of amazing programs that have come out of this partnership. One unique program that's happening as we speak is our VeggieRx program, where any of our providers or nurses can refer a patient to get free vegetables. Along with that, they can meet with our nutritionist and get a personalized plan of care. They even have a tasting session where they can taste the food that's cooked in the box. This year alone, we'll give 15,000 boxes of vegetables to our patients. We're trying to figure out how we can leverage the resources that we've been given to make a difference. So we know we have to be excellent in the exam room with traditional medical care. But if we're really going to move the needle on life expectancy, to address some of the social determinants of health, we have to think outside of the box. And it's been a privilege to work at a place that has the resources and the vision to do those types of things.
Theologian Frederick Buechner writes.
Okay, we're going to stop there for a second, and I'm going to try and switch over to a slide deck. Let's see if this works. Can people hear me? Okay. All right. So that was the video, right? So now we're gonna back up, and I'm gonna go into a little more detail. I'm gonna tell you a little bit about the health center, how it started, and then as we walk through, we'll hopefully be able to illustrate some of the ways that this interplay between the work that's going on in the academy, the work that many of you are doing, and work on the ground here on the west side of Chicago. So I'm going to give you what we call the $1.50 tour. We have different tour levels at Lawndale, the 50-cent tour, the $1 tour. The $1.50 tour is going to get you face-to-face with these two guys, Cliff and Israel. Now, they're in charge of our maintenance team, and I always stop in here if I really want to make the point about what's special about Lawndale, because these guys are as essential to the well-functioning of this organization as the CEO or any other provider there, right? We were asked during the pandemic in 2020, we were asked by the Commissioner of Housing whether or not we would take over a boutique hotel in downtown Chicago for the purpose of shielding the highest risk people living in congregate settings in our homeless shelters in the city of Chicago. But because this was at the beginning of the pandemic and people were afraid and they didn't know what was going on, they said, you can't just do the medical care. We need you to do everything. We need you to provide transportation. We need you to clean the toilets. We need you to take care of the rooms. The only thing we're going to provide is we'll cook the meals, but we're not going to deliver them. And the only reason I had to, of course, I had to have the medical support to do that. But the real key on that was everything else. And so the first person I called up was Israel. I said, Israel, can we do this? And he said, I think we can. And so for 9 months, we did this project that ended up being, by the grace of God, quite successful. We had 259 of the highest risk people living in this shelter, and we're able to protect them. 133 went directly from the hotel into permanent supportive housing. This the findings that we had on the medical side were published in JAMA, and all of that was made possible because of folks like this. And so that's one thing that I think that people, if you come to our health center, if you come to Lawndale, one of the things that's different about it is this recognition that every person that works here is essential and a part of the mission, and that we see each other as not from a hierarchical perspective, but as co-laborers and as brothers and sisters. So just for perspective, on the left, you see the map of Chicago. We are in the one that says Lawndale there. That's North Lawndale. South Lawndale, it says Little Village. Our main health center sits right on the border. You can see it's circled. Ogden Avenue is Route 66, starts in Chicago and ends in the Pacific Ocean. And so you can see we're right on the southern border of North Lawndale. Now, North Lawndale is about 32,000, almost entirely African-American neighborhood. South Lawndale, 97,000, almost entirely Hispanic. In North Lawndale started out being a mostly Jewish neighborhood. Before Golda Meir was the Prime Minister of Israel, she was a librarian in North Lawndale. Dr. King moved to North Lawndale in 1966 to draw attention to racism in the North, specifically redlining for housing. And then when he left that summer. 2 years later, he was killed, and basically the west side of Chicago where he lived was set on fire. At that point, anybody who could get out of the neighborhood did. And then ever since then, the numbers continue to decline. A mark of success in North Lawndale is to be able to leave. Sorry. These are some pictures of the health center early on. You can see, so the story of how the health center came to be was that Wayne Gordon, who's in the bottom right picture, he's the second guy from the left. He moved in here after graduating from Wheaton College with a commitment to caring for, to serving mostly students through the Fellowship of Christian Athletes. So he moved into the neighborhood, which back then was kind of a big deal, and started a Bible study. Out of that Bible study came the Lawndale Christian Community Church, which officially formed in 1978. It was mostly a bunch of high school kids and some of their moms. And the story goes that as they were studying the Great Command to love God and to love your neighbor, the idea was presented that if we're supposed to love our neighbor as individuals, what would it look like if a church loved its neighborhood? And so that became sort of the rallying cry of Lawndale Christian Community Church, loving God, loving people. And so they identified different needs in the neighborhood. One of them was a safe place to do laundry because the gangs controlled the laundromats. Of course, one of the things on the list, one of the areas of need was affordable health care, quality health care. And so Art Jones, who is, I think, on the far right in the bottom picture, and Jan Rosbach, in the white coat in the middle, were in a Bible study together at University of Illinois. And Art would tell the story, he was in Liberia. They were planning to go overseas. And when Art was in Liberia, he said, I looked around and I sort of felt the God impressing upon him this idea. And it was that it was easier for God to call Western trained physicians to places like Africa than it was to get them to care for folks in our inner cities. And so that was where the moment at which he decided, and along with Linda, to try and start something here in Lawndale. So in 1984, 6 years after the church started, Lawndale Christian Health Center was founded. These numbers are a little bit outdated, but just to give you a real basic sense of things, I think as I said, we'll see 175,000 medical visits this year. You can see 98%, 99% of our patients are 200% below poverty. racially and ethnically, we're about 50-50 in terms of African American and Hispanic. We are privileged to have great leadership at Lawndale. I put this slide in there. I basically took all these slides from other people's slide decks. So, but this one is Pastor James Brooks, and he would be joining us today, but he's in a conference in New Orleans. I think I just want to point out that, you know, while I was here, I've been here 25 years. Bruce Miller was an amazing leader and really helped us to move things forward in all kinds of ways. And so then it came, as he decided to retire, they did a national search, and the person that was chosen by our board of directors was the person that was at the time serving as our spiritual care director and director of ministries, Pastor James Brooks, who grew up in North Lawndale, is the pastor of Harmony Community Church, and now he's our CEO. So I don't know how many other $70 million federally qualified health centers have a pastor as their CEO, but we count this a great privilege to be able to work under this guy. And that, again, sort of illustrates how this place is a little different. I'll just highlight some of I've already talked a little bit about this, but just to highlight some of the things. So I know that there have been some writings, even among y'all down at the Center for Theology, Medicine, and Culture, questioning whether or not Wendell Berry was right when he said that the smallest unit of health is the level of community. But this idea, though, has actually helped us to think differently about medicine. And as I said in the video, one of the areas where we saw a need was to give people a safe place to exercise. Now, we didn't know if anybody would actually use it, so we started off really small. But eventually, we built a very significant fitness center, and we open at 5 in the morning, and it's packed. I think we'll do a couple hundred thousand patients right now. It's kind of where we are, and it continues to grow. If you give a moose a muffin, he'll want a glass of milk to go with it as well. And so you can't have a fitness center without a place to get a green smoothie, right? And so we built the Green Tomato Cafe because we learned from Norman Wiersbe and other people down at Duke that that having a meal together is pretty basic stuff, and it's kind of important. And so we tried to create a place where people could get some food that wasn't out of a deep fryer, that was affordable, so people could just do life together. In 2010, I had the privilege of participating in the Reconciliation Summer Series with Chris Rice. And I also got to take a course from Norman Wiersbe. It was probably a week-long course. And at the end, I said, well, Professor Wiersbe, this is all cool, what you're doing down here, where you all have land. But do you have any models that work in an urban area? And he told me about a place in Milwaukee. I came back and took my kids up the next day. That was the advantage of homeschooling at the time. We went up there and toured a place that was created called Growing Power by an ex-pro basketball player, Will Allen. He got a MacArthur Genius Grant for this work, and I could not believe what I was seeing. We came back, met some folks doing this tiny little urban garden on the west side, and it turns out it was a Chicago Botanic Garden. Couldn't believe it. And so we said, what can we do? Is there any way we can work together? In 2010, you know, I went to our CEO and said, hey, you know, we've had success with a fitness center, but there's this whole area of food insecurity, not to mention injustice in the food system as well. And just basically parroting what I learned from Professor Wiersbe, right? And I said, you know, we may have a chance to partner with the Botanic Garden. And our CEO was like, well, what are you talking about, right? We're not a farm. We're going to do a farm. And so the CEO at the Botanic Garden had the same reaction. You're going to partner with a faith-based Christian health center, right? And so this is what we were talking about in 2010. It was about 2014, right when Calvin Gross came to Lawndale, where we started to get some traction, because our strategy was to start to do some small projects together to help people catch a vision for this type of thing. And so it was around 2014, 2015 where our organization started to believe that this could be possible. Today, the Farm on Ogden has a job training center for people who have been incarcerated, a 75% success rate after completing the 3-month program. We have a corner market where people can access affordable, locally grown food. We have a Veggie RX program where, as I said, this year we've distributed 15,000 boxes of vegetables. And so these are just little examples of ways that Lawndale has taken some of the things that we've learned as a result of the work of the theologians and the folks at Duke and Georgetown and elsewhere, and tried to make it practical. I'm going to stop sharing. I'm going to take this time to invite Calvin Gross. So as I said, one of the smartest things that we ever did was in 2006, we decided to hire what we called gap year interns. So these are folks mostly who are thinking about going to med school, but they need a time in between then to sort of work out their calling, that type of thing. And so this started in 2006, and I believe it was 2014 when Calvin Gross came to us from Princeton University. And so I'm going to stop there and invite Calvin to share a little bit about his experience coming to Lawndale, coming out of a place like Princeton. And then Calvin then did the TMC program and got his master's degree. And to work out how all that fits together.
Thanks for having me, everyone. It's very exciting to be here and to reflect back on time at Lawndale and to reconnect with people at Duke. I think there are a few things that Lawndale has always struck me about Lawndale, things that I think are particularly Christian and help to illustrate and also relieve, I think, some of the things that are wrong within medicine. I think one of the things I remember at Lawndale is that ethos of everyone here matters. We care about everyone. There is no hierarchy because we're all brothers and sisters in Christ who are called to do the same work of taking care of people who, to a large extent, no one else wants to take care of. And that level of equality with each other and equality before Christ, I think, brought a level of motivation, a level of resilience, and a level of joy to work, which isn't to say that taking care of people who are deeply disadvantaged is easy or becomes easy, or working with all different kinds of people is easy. But I think in a time in medicine in which there's a lot of disillusionment, a lot of disaffection, a lot of questions about too many administrative powers, about people feeling devalued, that a sense of we are all here to work together to serve the poor, I think, to me, has just been strikingly different from any other context in which I've practiced medicine, and I think comes from a particularly Christian motivation. The other thing I think that is reflected on a lot over time is, I think one of the things we ask a lot about in the TMC and at Duke is, what is distinctively Christian about the way that we practice medicine or the way that we do things? Is it the way that we spend time with patients, the way that we reflect on things, we give our presence? And I think all those things are true, but I think as you look at the witness of Christians across time, I think that the moments of greatest witness and the moments of greatest distinctiveness are when we as Christians build new things. We try new things that other people aren't doing, and I think create institutions and programs and ways of doing things that are distinctive, and I think provide a really poignant, powerful witness to who we are. And I think that there's so many examples all the time. The whole entity of hospice care is invented by Christians to say to people who are sick and dying, we love you and we care for you. Or the witness of the Mennonites in providing psychiatric care in the mid-20th century. And I think of Lawndale as the same thing, that to be able to go into a room and to say, we are Christians and we care for these people, and we are living amongst our neighbors, we're taking care of these people, and we're doing all these strange creative things that are oddly motivating, I think, is something that in conversations and since I left is something that people always want to know about and always ask about, something I've returned to.
Yeah, thank you, Calvin. And as I said, the opportunity to have folks like him come through here has been just fantastic. And I'll give you an example of how I think, and I heard Dr. Carlo use the word, she used a word that when she talked about the relation between Lawndale and the TMC group as evolving or something like that. And I hope that's what we have here, because I think there's real potential for strengthening relationships between not just Lawndale, but places like this. There's a whole organization called Christian Community Health Fellowship whose byline is living out the gospel through healthcare among the poor. And what we have is a group of people, it's sort of ecumenical in the sense of it's not particularly Protestant or particularly Catholic or Orthodox organization, but people who feel a sense of calling to leverage the gifts that they have and the gift of medicine to relieve suffering, and especially to in the context of serving the poor. Let me read something that that shaped me a bit after I came to Lawndale. It was a book published that you all know about in 1994, The Scandal of the Evangelical Mind by Mark Knoll. But let me read you the first paragraph, and then I'm going to talk a little bit about how I think that he was right, and how I think that within medicine, these kinds of relationships have an opportunity to change that. The scandal of the evangelical mind is that there is not much of an evangelical mind. An extraordinary range of virtues is found among the sprawling throngs of Protestants of North America, including great sacrifice in spreading the message of salvation in Jesus Christ, open-hearted generosity to the needy, heroic personal exertion on behalf of troubled individuals, and the unheralded sustenance of countless church and parachurch communities. Notwithstanding all their other virtues, however, American evangelicals are not exemplary in their thinking, and they have not been so for several generations. When I read that, it resonated with me as somebody who grew up in an evangelical setting. And, as I said, Coach, we call the guy that was the founder of the church Coach, but he came from Wheaton College, evangelical kind of a place. And so we saw this thing. And as I came to Lawndale, I looked around and I saw these saints, providers, nurses, registration reps, serving the poor, sacrificing for this work. I mean, I can tell you the story after story. When I came, the health center had already been going for 15 years. But even then, I remember seeing an article in JAMA that said it was entitled Urban Clinic Embracing an Age of Managed Care. And even by the time I came here in '99, our health center was well known for being innovative, for doing low-cost care, achieving excellent clinical results, and was being recognized by the state and others as an innovative place trying to figure out a way to do better than the system was currently doing. And so this place was, I remember, I'll tell you a quick story and how we got here partly. Pam Smith grew up in the neighborhood a few blocks from the health center in North Lawndale. She managed to get herself admitted to Yale Medical School, and then came back and did her OBGYN residency at Mount Sinai Hospital. She grew up in a single parent kind of a family and was really her family's ticket right out. But when she finished, she came back to Art Jones and she said, could you guys use an OBGYN? This is in the late 80s, early 90s. And Dr. Jones said, we could, but we can't pay you much. And Pam Smith said, well, how much can you pay? And she came to work at Lawndale for $35,000 a year. And that's the kind of commitment that it took to get this place going. And so by the time my wife and I, Gina is a pediatrician, we came here right after residency in 1999, but this place was already doing amazing work. And it was because of people like Pam Smith and Jan Rosbach and Art Jones and Jerry Manos and on and on and on, Shirley Wong, who took this incredible financial sacrifice in order to make this happen. The mission of Lawndale is to show and share the love of Jesus by providing whole person affordable healthcare. When my wife and Gina and I were interviewing at the University of Chicago, we were not engaged at the time. We interviewed separately, but we found out about Lawndale because when she was interviewing, Dr. Kim Williams was a nuclear cardiologist at the time there, and he said to her, you're an excellent student. I think this is a great place for you. I see that as a reflection of your faith, you want to serve the poor. And of course, at that time, she was thinking she's going to end up overseas somewhere in a developing country. And he said, have you ever heard of Lawndale Christian Health Center? There's this little clinic on the west side of Chicago that's doing some amazing work. And I remember when I came out, I was in Connecticut at the time, and I came out and she told me about this, and we came over to Lawndale and visited. We just kind of showed up. There was nothing to look at the time. It was an old car dealership that had been stuccoed over, no windows, 8 exam rooms, probably just a couple of providers, maybe 4 or 5 providers working at the time. But we were blown away. And to this day, I can't name the specific thing that was so captivating, except that we met these people whose mission of the organization named Jesus right there, and recognized that it's not separate, right? That our calling isn't separate from our theology or from our religion. And so they were people that believed the story, and were trying to act on it, and to ask questions about, if this is true, then how does that affect how I think about what medicine is for? If this is true, how does it affect where I choose to live and raise my family? At the time, all of the providers who were working here lived in the community. That's not a requirement anymore. It used to be, but I think about 1 in 3 providers lives in the neighborhood now, but that's just different. And so I think one of the things I appreciate about Lawndale is recognizing that if the story is true, it changes everything. Not just how we think about the latest bioethical issue of the day, it changes things like, what is medicine for? What is the end of medicine, right? And then you read things from, Hauerwas, who says, the physician's commitment is not to cure, but to care. Well, what does that mean, Professor Hauerwas? How does that work itself out in reality? But the truth is, I think he's right. And so we take those little crumbs that fall from the theological table down there, and we try and put them into practice. When we were fortunate, we're 40 years this year, but just wasn't that long ago where we had our first psychiatrist, Dr. Lisa Crystal. And I was well aware that one of the problems with getting a psychiatrist at the community health center is that they burn them out instantly. We have 70,000 patients. And so I was scared to death that we were going to burn her out. And so I said, well, do you know about the work they're doing down at Duke? Do you know about Abe Nussbaum in Colorado? Do you know about Warren Kinghorn? And I introduced her to those folks, and she took it from there. And I can tell you that it was just knowing about your work, and knowing that there were others out there who were thinking about these things, and who cared about the intersection of theology and medicine, and specifically mental health, were very helpful in sustaining her. A few years later, 3 years ago, we got our second psychiatrist, Dr. Louisa Olashoga. She did her residency at University of Chicago, her fellowship at Northwestern, and I'm quite sure she took a $100,000 pay cut to come and work for us. As with many of our providers, they could be working in any place in academia, and yet they come here because they have this sense of calling. So I'm gonna invite Dr. Olashoga, who has been at Lawndale now for about 3.5 years, to share a little bit about her experience and coming here, and how the place has kind of shaped her. And she's welcome to say whatever she wants.
Thank you so much. I always love rehearing the story about Lawndale. I think sometimes when you're in the work, you can kind of forget how far-reaching the work really is. We all get into our exam rooms and our clinical rooms with our patients and get so focused in that space. So as Dr. Detmer said, I've been here since October of 2020, in fact. So I onboarded here at Lawndale right in the middle of COVID, right amidst the hotel that they were working through, and quarantine. And I'd actually finished up my reproductive psychiatry fellowship in quarantine, and started at Lawndale in a telehealth capacity. And coming to Lawndale, it wasn't a simple decision. And then I think that's something that I've come to appreciate about God's calling. Like, it doesn't always feel like butterflies and rainbows, and sometimes it's kind of uncertain and trying to weigh all the things. But I did land here at Lawndale for a number of reasons, and worked alongside Dr. Crystal, doing our best to manage psychiatric care amongst our Lawndale patients. And then not far into my starting here, I got a call from Dr. Detmer to say, or to ask really, if I would consider that they'd been working and doing this hotel, which I really wasn't familiar with. You know, I think many of us got in Lawndale and we get this either 50 cents, somewhere between 50 cents to $1.50 tour, and you get downloaded all of this information, but you kind of forget some of it because, you know, you're not at the fitness center every day, you're not at the farm every day. You kind of forget how far reaching our work is. And so you called to remind me, or to tell me, I don't know how aware I was of at the time, that there had been a hotel that they had been using as a place to shelter those experiencing homelessness at the time throughout the pandemic. And I remember he started this conversation, and I kept thinking, I was trying to fast forward his conversation, like, what does this have to do with me? Actually, you know, like, I'm not a primary care doctor, there's not much I can offer here. And he finished by saying that essentially what they're realizing, have noticed, is that there's a lot of serious mental illness that is going untreated, that while their providers are there doing their best to manage primary care things and manage, you know, just infectious disease control protocols, that, you know, psychiatric care just wasn't part of what they could even pretend to try to do. And if I would consider providing psychiatric care to these patients, and I mean, that in and of itself as an ask of like, can you do psychiatry as a psychiatrist, wasn't really so big. But the part of it was that what he actually was asking, with more clarification, was if I would be willing to go into the shelters specifically, not the hotels, into the various shelters around the city, to provide in-person psychiatric care to this population. And I can say for sure that in-person psychiatric care in homeless shelters was not part of like the reason I came to Lawndale, or part of even my understanding of why I was supposed to be at Lawndale. And truthfully, and this is a piece that I think we sometimes we try to gloss over. Truthfully, I just didn't want to, right? I'd spent several months at this point quarantined with my family. At that time, it was, you know, my husband and my daughters, you know, gearing up for a pregnancy. I hadn't really been out, you know, psychiatry. We're one of the medical specialties that are fortunate to be able to do and offer virtual care. And so, I mean, the idea of going into homeless shelters in the midst of a COVID-19 pandemic to give psychiatric care, mind you, like, did I really know how to do psychiatry yet? Not really, because I just finished fellowship. So I felt like I also wasn't completely sure or confident of myself and my skills as a clinician even. But this ask came, and I said yes. And I would be lying if I said yes because I really wanted to, or because the clouds opened and the Lord said, Louisa, go into the shelters, and I listened to this calling or this warm feeling. I mean, truly, I said yes because Detmer asked me to. And I don't know, he's my boss, and I was just trying to be a team player. And they literally just hired you. Are you going to say no to the first thing that they ask you to do? I mean, it was a number of these responsibility, you know, and just playing and taking a hit for the team. Not because I wanted to, because, well, who else going to do it? And at the time, my co-psychiatrist, who's no longer at Lawndale, she since has moved to New York, but she was also busy on the ground managing our 75,000 patients in the clinic proper, and just couldn't go into the shelters either. And so that's when I started our work delivering psychiatric care in homeless shelters. And that's one piece that we didn't talk much about as to what we do here at Lawndale. And it has become one of the largest parts of what I do here at Lawndale, and one of my most favorite parts. And 3 years into this, I can say is feels like much of what God called me to Lawndale to do, despite my resistance to do it in the first place. But the way we care for people doesn't just begin and end with the people who walk into our clinics and have the ability to get there. This idea of trying to bring resources and meet people exactly where they are is what is just what is displayed through our mobile health team. And that's our team of providers are clinicians and staff who go into shelters around the city. Literally their persons and their suitcase. In some places there's maybe a clinic room that Lawndale has been able to erect. In other places there's a table with some foldy accordion divider. But to be able to just deliver care, and it's not lost on me as a psychiatrist, as a psychiatrist with Christ at my core, as a Christian psychiatrist who's a woman, as a Christian psychiatrist who's a woman of color, it's not lost on me just the blessing it is to be with our populations and the people that we serve. And it's not an uncommon experience, actually, for me to go to see a patient and, you know, at this point it's been prepped, like, okay, you're going to meet with Dr. O when she comes on Wednesday. And a patient walks into the room, and it's happened at least 2 or 3 times where a patient sort of is looking at me slightly confused, and says something along the lines of, wow, I didn't realize you were Black. And which is pretty heavy, because much of the interaction that a lot of my patients, particularly those experiencing homelessness, have had with psychiatric care has not been pleasant. A lot of it has occurred during times of being incarcerated. There's this association they have of what it means to work with a psychiatrist and what that looks like and what that person looks like. And usually it is a white male. So to be able to sit there with them, being the whole person that I am, is something that has just been so enriching for my time here at Lawndale as a provider, generally in the clinic. Something that has been completely humbling too, right? Because for every person that has that experience and sort of that reception, you know, there's always someone who's a little bit more hesitant because it's so unfamiliar. But it's such a beautiful space that Lawndale works so hard to occupy, and we don't do it perfectly, and Lord knows I don't do psychiatry perfectly, and there is only me, and there's all of homelessness, I suppose, or Chicago, right? But it is so much shaped who I am as a provider. I've often said that, you know, I came to Lawndale because I had a heart to serve this population of people who were under-resourced and otherwise disadvantaged and on the margins. And that passion certainly has grown, but part of what keeps me at Lawndale too is just to be in a team of people who has the same heart, who's working towards the same mission. You know, to be able to come out of an exam room to know that I'm meeting someone in Christ, to remind me that it's not me who's supposed to be fixing the situation, but it's, you know, the Christ in us, and that these people were and are his sons and daughters before they were our patients. And I think that aspect, you know, much like Calvin spoke to and Detmer spoke to, of our all being part of this body just trying to do a work, is such a strong piece of what it means to be part here at Lawndale on the good days and the bad days. And so where my work with the mobile health team has continued to be one of my favorite parts. And at this point, if you told me that I couldn't go into the shelters anymore, I couldn't be on the mobile health team, I would be having conversations about whether I could stay at Lawndale, right? Like it's that much a part of what I do. But to be able to do it alongside people who believe wholeheartedly in the same mission of delivering care and loving people, I think really has made all the difference in my practice.
Thank you, Dr. O. So we could talk a long time. I actually, there's the $1.50 tour, but when we started the residency, they asked me to give the residents a real orientation to Lawndale, and they asked me how long I needed, and I said I need a day. So I get a Lawndale van and a driver, and I literally take 8 hours with the new residents for their orientation and drive them around to the various shelters and all of the different places where we work. It's already 45 minutes in, and so we're gonna just pause here. I mean, we could talk a lot more, but I want to leave some space for questions. So if folks want to ask questions of me or Calvin or Dr. O. And also I want to give a shout out to Bennett Zucker, who is another amazing gap year intern who's now leveraged what he took at Lawndale in not to do clinical medicine, but to be working with people on the administrative side. And he did the TMC program there. I think Andrew Kim is likely going to be coming down from Lawndale soon. And I also want to give a shout out to John Hart, who the second, after 2 sentences of talking to him back at University of Chicago over lunch one time at one of those seminars, I knew we had a kindred spirit. And he's our go-to guy that when we have an ethical dilemma, we just call up John Hart. So I think Dr. Carlo is going to take questions, and then we're gonna see how we can.
Perfect. Thank you, Wayne. So as Victoria has written to the chat, you could use your raise hand function or actually just unmute and ask a question, and we'll sort of manage that. I know that Farah had some in waiting, so I'll let him start if he would like to, and we'll give everybody else a minute to think about that.
Yeah, so good to see you all. I'm perpetually grateful for the time I had living there in Lawndale and hanging out with the people of Lawndale. It really is a remarkable, it's stunning, honestly, what it has become. Wayne, we used to talk about, and you kind of brought this up, about that challenge of, I mean, I think many Christians think of Lawndale as paradigmatic Christian healthcare, even just because it's serving the poor in Jesus's name, which is a lot, and doing it with remarkable creativity. But we used to talk about, but if we have a system, healthcare system, and a cultural system that we expect as Christians is going to be broken and distorted, how do we offer medicine that's not just conventional medicine or standard medicine and its corruptions, but that is in some way distinctively consistent with the Christian story? And I'm just kind of curious how you wrestle with that these days, and thoughts you guys have on that.
I think one of the questions I had at some point, because I didn't know, was like, well, how early on did the church embrace medicine, or did they ever embrace medicine? And it was helpful to read about, Basil or and other people who, or even Constantine's mother, I understand, said that, okay, wherever you put a church in a city, you also have to build a hospital. And so it was helpful for me as I learned some of the history of the relationship between specifically the church and healthcare, to think that at least we're probably on some kind of a right track. And so in some ways, what I see the work that we're doing at Lawndale is sort of reclaiming that commitment to using the gifts that we have specifically to relieve suffering. And then, of course, Jesus has a particular interest in caring for the vulnerable, people on the margins. And so by the grace of God, we've been able to be in that space. And then the question is, well, what should our position be, right? And this is where, in some ways, Professor Hunter's, did I just get it right? James Davison Hunter, yeah. Comes in where you say, okay, well, we can have all kinds of different postures toward culture. We can have us against them posture. But I think that the posture that we've taken, at least that I inherited when I came, was one of come and see. I think it was actually Mark Noll wrote another book called Jesus and the Life of the Mind. And in there, he talks a lot about when Jesus was questioned about, what do you think about this, Jesus? He said, come and see. And so part of what we're trying to do, because there are things that we're doing, right, that are that people aren't gonna agree with. Like we don't refer for abortions, for example. And even within the Christian world, right, that could be controversial. There are just things that we believe in the right of conscience, and so we allow that within our health center, and we have people that are all over the place on that. But we want to respect that. But we're trying to do everything that we can do to abide by the rules of medicine and the law in such a way that does it as best as it can be done. So, for example, I remember there was a conference at University of Chicago, and I don't remember who was hosting it, but there were ethicists from all over the country. And the question was on this issue of right of conscience. Does a pharmacist have the right not to prescribe, not to dispense this if it violates their conscience? It was not a particularly faith-based group, I remember. And I had no idea what they were going to conclude. And I remember the conclusion was, we believe in this right of conscience with one asterisk or one restriction. And that is that people do the very best that they can to let patients know before they meet the provider what they're getting, so it's not a bait and switch, or there's not an uncomfortable situation. And I listened to that, and I came back and said, we were not doing any bait and switch kinds of things, but is there anything we could do better? And that led us down a path of, you know, well, what does that mean for us specifically in obstetrics? Does that mean that we need to put a sign out that says we don't do abortions here? And where we ended up was saying, no, look, if why is it that we say that in the first place? The church is famous for what it's against, but what are we for? And so then we start to look at some of the Catholic literature and some of the other work. And so the way it changed us, instead of sort of leading with what we're against, it's what we're for. You know, we believe that all life is a gift from God. That's different. Like, we actually believe that. And that does change everything. I'll stop there. I don't know if that answered your question, but it's something like that.
Thank you. Thank you.
Very good, Wayne. I see 2 hands up. Let's go with Bennett first and then Michelle. You good?
Yep, sorry, I was double muted over here. Great to see you all. Great to be with you, Dr. Detmer. Dr. Curlin kind of stepped on my question, so I'll change the focus a little bit. But kind of piggybacking off of that, as an FQHC, kind of intrinsic in that model is some element of partnership with the state. And we've talked quite a bit about this. I mean, even the example of Chicago, the city of Chicago coming to you and asking you to run the hospital during COVID, or the hotel during COVID. Can you talk briefly, if possible, about some of the challenges and also gifts of partnering outside of the church, outside of the local community, and with broader state programs in administering and caring for and with folks in Lawndale?
Yeah, thanks, Bennett. I think that I'm gonna tell you as briefly as I can a story that really I think it was a God thing. The way God taught me something. I was pretty sure that this partnership with the Chicago Botanic Garden was really, apart from these other things of like taking federal money or whatever, but like Lawndale historically up until that point had never actually partnered with a secular organization in such a way where we're co-branded, right? There's Chicago Botanic Garden, Lawndale Christian Health Center. And I was pretty sure, or I was worried that 50 years down the road, they're going to be like, hey, this is amazing. Look at all this amazing stuff they're doing. Didn't this used to be a Christian organization? But yeah, I think years ago it was. Well, what happened? And they'll look into the history and they'll figure out that this guy, Detmer, started a partnership with this secular organization. And that was the beginning of the slippery slope. And you know, it all went out the door after that. I think there's a way, but what I've discovered is I think there's a way to be faithful Christians and probably faithful other faiths too, and to do it in a way that is, I think the key is honesty in some sense, right? We have to be honest and not pretend like we have the market on anything really, on except maybe hypocrisy or something like that. And so when we're honest, I think it can really change things. So here's the example. The guy that was in charge of all of the aquaponics work back there, he's 10 years my senior, and he'll tell you this story too. His name is Andy. And after the grand opening on 2018 of the farm, and we had, you know, Dick Durbin, the senator, and all the fancy people left, Andy looked at me and he said, man, why couldn't it be like this outside of these doors? And I said, what do you mean, Andy? And he said, well, to be honest with you, I wasn't super thrilled partnering with a religious organization. He said, you know where I'm at on that thing. And he said, outside of these doors, we should hate each other. He said, I should say, you're some kind of religious crackpot. And you should say, here's some pagan going to hell in a handbasket. He said, but the truth is, there's no organization or no group of individuals that I respect more. He said, you've changed me and you've changed the Chicago Botanic Garden. That was a gift to me. And the truth is, I had to think about it, but I said, Andy, the truth is you've changed me and you've changed the Lawndale Christian Health Center for the better as well. And so this is, I think this is precisely example of faithful presence. We don't have to change who we are. We can be honest and we can learn from each other, you know? So thank you for the question.
Thank you, Wayne. I'll give Michelle a comment, but I feel like your answer to both of the last 2 questions just point to the Christian message of abundance and not scarcity, of trusting in our abundance and sort of celebrating that and moving towards it. Michelle, you might be the last question, but go ahead and unmute yourself.
Sure. My name is Michelle. I work in spiritual care at a large hospital here in New York City, also studying healthcare administration. And one of the things I keep hearing in those studies, and we probably know across the system, is that there seems to be an ever increasing focus on using technology and efficiency to really solve the healthcare crisis. And to Martha's point about scarcity and abundance, the argument's often made that there's not space for treating patients with dignity and value and offering the presence to them. So how do you see us addressing that? Do you think it's just going to be confined to small faith-based clinics, or is there a way to recreate that space, which, as you alluded to with history, once existed within healthcare, that we cared for spirit and dignity as well as the body?
Thanks for that question. I'm going to give you two really try and be brief examples of things. And again, this is all the grace of God. To the degree that we're doing anything right, I honestly believe it's by the grace of God. But I'll tell you two things. So one is, as even reading people like Hauerwas and talking about this ministry of presence. And so we started our gap year program back in 2006, and sometime around 2012, thinking about this idea of presence and being in the ministry of presence. I heard somebody talk about how stressful it was to be in the hospital or whatever. We have a formal chaplaincy program, but what I did was I started hiring gap year interns to be inpatient care coordinators. Now, they didn't have any actual training in chaplaincy or anything, but what I told them, I said, your job is to practice the ministry of presence, meaning that you have to go in there without any actual legitimate reason. Like you're not a social worker, you're not a chaplain, and you have to say, hi, my name, and our first person her name was Grace. She's an ophthalmologist now. But Grace would go in the room and say, my name is Grace. I work at Lawndale Christian Health Center, and I'm just here to see how you're doing and if you need anything. And their job was to listen and to just to be present. And I can tell you that model is being replicated now by others because they're seeing the value in just being present. And I can tell you story after story of how not only was it a blessing for the patients, but many times my inpatient care coordinators would come home with tears in their eyes saying, the patient just spent 30 minutes praying for me, that type of thing. And so I think part of this is, again, this idea of come and see. So we do this inpatient care coordinator thing for the sake of our patients in our health center, but other people see what we're doing. And so I think that's helpful. The other piece I'm going to say real briefly is I remember an article came out, I think it was in the Atlantic or the New York Magazine or something like that years ago, and it said the doctor will see, or the robot will see you now. And I remember a Christian surgeon at one of the top places in the country who's said in response to that, I think they're right. There will be no more need for primary care in the near future. And that stressed me out because I chose family medicine, right? So did I just waste my career? But then I started to think again from some of the stuff that I've learned from this group. Well, what's the real value of primary care? Is there anything that a person can do that a computer can't? And you heard me quote Hauerwas earlier, but I don't think we can make it look like a computer cares. But I think the only thing that can care is another human being. And so if there's any value, what I concluded was if there's any value in this work of primary care, sure, we have to try and do diagnoses and help people that way. And it may be true that computers will be able to come up with quicker differential diagnoses in the future than a person. But I'm convinced the one thing a computer will never be able to do is to love a person. And I think that's what we've got to do. We've got to fight the forces that tell us, it's all about productivity. It's all about churning people through. And we've got to demonstrate to the world a better way. And the better way is to show them what it really looks like to care about the person sitting across from you.
Great, Wayne. That's a good word to end on, the practical theology of what Lawndale Christian Health Center is offering. This has been a great conversation. I think we could probably continue for some time. And I hope for those of you who are new, it's a taste of what we are up to here at the Theology, Medicine, and Culture Initiative and the folks that we partner with. So thank you, Wayne and Louisa and Calvin as well for your input into today. And we look forward to seeing you again next month.